All right, so get this, the first signs of respiratory virus season are just starting to show in the U.S., but the CDC is forecasting this fall and winter will be just as bad as last year when it comes to respiratory illnesses and hospitalizations.
So get ready. Dr. McGeorge here with more on what's being predicted and how you can protect yourself. Doc.
Well, Karen and Damon, according to the Michigan Department of Health right now, here in Michigan, we are right here at a very low level of viral activity. But this blue line right here shows what happened in Michigan last year. Viral illnesses and hospitalizations accelerated quickly after about the midpoint in November. That's only a couple weeks away. Now, if the CDC is right, we should prepare for another very early viral season.
Right now, respiratory virus levels are relatively low in the U.S. overall, but the CDC is forecasting this season will be similar to the last one, which saw hospitals fuller than at any other point in the pandemic and worse than pre-pandemic years.
Time to getting into the hospital and getting that life-saving care can be delayed, and that can cost lives.
At the peak of this respiratory virus season, the CDC forecasts show there could be between 15 and 25 new weekly hospitalizations for every 100,000 people in the U.S. COVID-19 will probably account for half of those new hospitalizations, with flu and RSV combined accounting for the other half. To help prevent getting you or those around you sick, wash hands frequently, sanitize high-touch areas, and if you're not feeling well, stay home. If you have to go out, consider wearing a mask, and if you're sick, get tested.
Not only for COVID, but also for influenza. Remember, we've got medications that we can use to treat both of these viruses if caught early.
Everyone aged 6 months and older should get the updated COVID-19 vaccine and this season's flu shot. And the RSV vaccine is recommended for those who are most vulnerable for severe disease.
Now, I do have an important update that the CDC just issued regarding protection against RSV for infants that weigh more than 11 pounds. The antibody shot, called Beyfortus, was actually expected to be available for infants across the board under 8 months old and kids up to 24 months old for higher risk or severe disease. Now, it comes in 2 doses. That's the thing, and that's chosen based on a child's weight. However, the manufacturer is reporting a supply shortage of the higher dose. So, if your infant weighs more than 11 pounds, you do need to talk to your pediatrician because the higher dose is being prioritized differently at this point.
So I have a question about the graph that you showed in the beginning, because we shot up really fast, but then it went down fast. So do we think that's going to happen again this year, or what do the analysts say?
Well, so, actually, I guess we can only hope is essentially it. It really depends on what viruses are in widest circulation. This prediction is subject to a lot of variables. If it comes on quickly, I hope it ends just as fast. Unfortunately, we don't know, and it might not.